Good morning, everyone. Thank you so much for giving me this opportunity to speak to you today about ParkRx and the importance of nature contact. I have basically two messages for you today. One is somewhat somber, but the other is about what is motivating me to help make the ParkRx movement sustainable. ParkRx is a tool for motivating people to get outdoors for the physical, mental, and emotional health benefits. A silver lining of the pandemic has been that more and more people of all ages are getting outdoors and discovering for themselves the benefits of being outdoors. And if there was ever a time to showcase the benefits of a tool like ParkRx, it should be now. Unfortunately, if you look at our metrics, the actual level of prescribing has been declining. And so why is that? Why are healthcare providers not prescribing? And I think it's because they have never developed the habit of prescribing. And even before the pandemic, that was a challenge that we were facing. Over the years, I've kept hearing experts say that doctors don't prescribe exercise. And I felt that really couldn't be true. So I did a little digging. I did a Google search. I said, well, I Googled, why don't doctors prescribe exercise? And I found a quote from a professor in Australia, Dr. Anita Green. And Dr. Green says, we know that many medical students and doctors don't meet the guidelines for minimum physical activity. And we also know that the best advocates for exercise are people who believe it's important in their own lives. It's consistently been shown that the more active a clinician is, the more likely they are to think about exercise, to bring it up with the patient, and to help the patient become more active. Bingo, that's the same problem we face with ParkRx and prescribing time outdoors. Whether it's exercise or time outdoors, there are two key barriers to prescribing. One is a lack of training of healthcare providers, and the other is their level of personal experience. If they are not doing it for themselves, it makes it less likely they will prescribe to their patients. In 2013, the American Public Health Association adopted a policy titled Improving Health and Wellness Through Access to Nature. And among the recommendations are advise patients and the public at large about the benefits of green exercise, and provide education and training programs for health professionals that include information on the importance of promoting nature and contact through green surroundings. After 7 years, there is still urgent need to implement these recommendations. Last year, I presented to medical residents at George Washington University here in DC. Not a single hand went up when I asked if they received any training on the connection between nature and human health. The biophilia hypothesis of scientist Edward Wilson is at the foundation of our work. He believes spending time in nature is not optional, it's essential to leading a happy and meaningful life. Since air conditioning was introduced in the 1960s, Americans have been steadily distancing themselves from nature. We cocoon ourselves within our homes, our offices, and our automobiles. Prior to air conditioning, we did spend significant time outdoors. The barrier, between indoors and outdoors was more permeable. We lived with open windows and open doors, and most of the time we slept with the sounds of insects outside our windows. ParkRx is a tool that has a mission to reconnect us in a meaningful way with nature. The credit for ParkRx as a tool, I think, goes largely to the National Park Service. They were early innovators in creating park prescription programs in New Hampshire and New Mexico. And after bringing a program called Healthy Parks, Healthy People to the United States in 2011, they decided to convene a steering committee to determine whether ParkRx should be part of the rollout of Healthy Parks, Healthy People. That steering committee and its work became the core of the movement, and that's where ParkRx really emerged as a movement. On that original steering committee was a pediatrician from Washington, D.C., Dr. Robert Zarr. And Dr. Zarr went on to become the spokesperson for the National Park Service on park prescription. And Dr. Zarr is the founder and the medical director for my program, ParkRx America. There are over 100 of these programs across the nation, ParkRx America being the most extensive national initiative. If you are interested in learning more about the extent of ParkRx, a good place to go is parkrx.org, which is the National Park Prescription Clearinghouse located at the Institute of the Golden Gate in San Francisco. The model we use for prescribing is the one developed by Dr. Zarr, which features prescriptions being written within the patient visit. And the reason Dr. Zarr feels that is so important is that it maximizes the leverage of that trust relationship between the patient and the doctor. And it really increases the likelihood that the patient will actually fill the prescription by going out and visiting a park or natural area. I call our model a top-down approach because we work directly with those healthcare providers to inform them the benefits of being outdoors in nature and about how to use our particular electronic platform. With our model, the prescription is written and goes out as a text message to the patient. All of the personal information remains with the healthcare provider. It is totally HIPAA compliant. All we do is we track who is prescribing, how many prescriptions he or she writes, the percent of those that are actually filled, and we keep track of the locations that are being prescribed. Because of the challenges I mentioned earlier, ParkRx America and other ParkRx programs are really struggling to gain a sustainable foothold. An example is the venerable Nature Fill program in Philadelphia, which is a collaboration among the Children's Hospital of Philadelphia, the Schuylkill Environmental Center, the Department of Parks and Recreation in Philadelphia, and the U.S. Forest Service. And basically, they're winding down their program because of low prescribing among the healthcare providers. In order to generate excitement, gamification is increasingly being used to stimulate interest. Programs such as Kids in Parks, which is a national program headquartered in North Carolina, and Healthy Park, Healthy Person, which is a statewide program in Tennessee, incorporate point scoring, competition, and prizes to generate excitement and attract users. Probably the ultimate gamification initiative is Pokemon Go. And when I made a presentation in South Africa, I incorporated Pokemon example as of something that really has very little therapeutic value, because once people are outdoors, they're focused on the game. They're not mindful of their natural surroundings. As luck would have it, in the audience that day was a professor from the United Arab Emirates, and she was scheduled to do a presentation on Pokemon Go the next day. And she challenged me. She said, Pokemon Go is by far the most effective program to get people physically active outdoors. And indeed, if you look at the statistics, Pokemon Go over the past 5 years has had 75 million Americans participate. So our focus at ParkRx American is on what we call near nature, the places that can be visited on a daily basis. I frequently show an image called the Nature Pyramid that was created by two professors at the University of Virginia. Tanya Denkla-Cobb and Tim Beatley. The image is very simple. At the top of that pyramid are those exotic and rare locations that perhaps you would visit once in a lifetime. Under that, the large national parks, and below that, the state and regional parks, and at the base of that pyramid, the local and parks and green space locations. So we focus on the experiences that those local places can provide, whether it's time outdoors at a park, or if the patient really has little experience, it could be more time in a backyard, more time on a balcony or a deck, just whatever it takes to get the person outdoors more frequently and on a regular basis. Most of our work is in cities, and cities, of course, are known as heat islands with vast stretches of asphalt and concrete. And yes, it is possible to have a meaningful relationship with nature in an urban environment. It can happen in a vacant lot. It can happen with a tree outside a window. It can even happen with whatever's growing in the cracks in that asphalt and that concrete. The health benefits from a physical standpoint, I think, are fairly obvious. From a mental health standpoint, there are now well over 200 studies that show mental health benefits from a variety of standpoints. Recently, I've been focusing and intrigued with the ability of nature contact to increase level of happiness. I worked for many years in local parks and recreation, looking at customer satisfaction surveys for park and recreation programs, and feeling very frustrated that most of those programs were showing a 95% or better satisfaction. And I said to myself, there's always reason to improve. Those programs are not that good. We must be measuring the wrong thing. 2 years ago, I heard a professor from Japan talking about the concept of Ikigai, which roughly translates into life satisfaction. And the bell went off in my brain. Yes, we were measuring the wrong thing. We should have been measuring life satisfaction. And doing a little more digging, I found that researchers have identified two types of experience that have a bearing on our happiness: the hedonic and the eudaimonic. And the hedonic is more of the sugar rush. It's a short-term pleasure that we get, the types of things that we were measuring in those park and rec surveys. The eudaimonic is the longer term, and the analogy is having a hobby that you've been engaged with over a long period of time that gives you great satisfaction. And when you have that longer term relationship, you can actually reset your happiness set point and increase your overall level of happiness. And I think there's an analogy to made with our exposure to nature. So you can be outdoors and have those wonderful, exciting moments, the hedonic pleasure. But if you have an ongoing relationship with nature, you can also get that eudaimonic experience that can help increase your overall level of happiness. So I say that you can get the trifecta. You can get the increased physical and mental health benefits, and you can also improve your overall level of happiness. So what is the future of ParkRx? I recently heard someone say that ParkRx is just a terrible business model. You're trying to convince healthcare providers who, in some cases, are very skeptical that the evidence is there to justify prescribing. Many of them view parks as unsafe, and they're trying to convince patients who have been conditioned about all of the dangers of being outdoors, including sun exposure, insect-borne diseases, and child predators. So given that situation, we at ParkRx America are really trying to broaden the audience for ParkRx from a very basic level. So we've been trying to get into public schools where students and their families can have positive nature experiences and learn the benefits of being outdoors. We are working to be on university campuses. We have our first program at the University of Maryland, so that the students who are so stressed can go to their medical center and receive a park prescription to visit a site on or off campus to help reduce that level of stress. I think we have a tremendous market in employee health and wellness programs to get people outdoors. I would say, whatever you do, if you do it outdoors, you get more of a health benefit. As we know, the pharmaceutical industry knows that there's great power and profit in getting people to go to their healthcare provider and requesting a specific type of medication. So in that vein, we have created our own park prescription card that is bilingual and that can be taken to your healthcare provider. There's a URL code on it, and the healthcare provider can log on and find out about ParkRx. So in closing, let me just leave you with the message that if you really think that ParkRx is a valuable tool in providing that incentive, to get people outdoors, something they would not otherwise do, if it is valuable in reconnecting people with nature, keep in mind the two necessities. We need more training of those healthcare providers on the human health benefits of being in nature. And we also need them to get outdoors and have that personal experience. Because without that training and without that personal experience, they are less likely to prescribe. Thank you so much.